Hello, everyone, and welcome to Flossy Ladies with Xyrus. My name is Elaine Bylis. Thank you so much for being here today. The purpose of Flossy Ladies is to interview different women in dentistry of different ages and different specialties. We're going to hear their stories, hear their challenges, and see how they overcame them. My guest today is one of my absolute best friends of all time, Dr. Molly Kovalesky. Dr. Molly and I went to University of Maryland Dental School together. We graduated in 2017, and she now practices as a pediatric dentist in Saratoga, New York at the Smile Lodge. Dr. Molly, hi.
Hi!
How are you doing?
I'm doing amazing. How are you doing today, Dr. Elaine?
I am doing so well. Thank you so much for being here. So while I was preparing for this interview, I had this little realization. 4 years ago was March of 2017. If I told you 4 years ago that you and I would be sitting here doing this interview and that people might actually want to hear what we have to say, would you believe me?
Oh, 100%. Who didn't want to hear what we had to say all the time?
Thank you. It's so crazy how much has changed in the past 4 years. And I'm just so honored to have you as my very best friend. But okay, to start today off, I would love to just hear, what is your story? So what made you want to become a dentist? What made you choose pediatrics? And how did you end up at the Smile Lodge? So take it from the top. Let's hear.
Well, first, Elaine, I just want to say thank you so much for having me. Of course, it's crazy I got to address you as Dr. Bylis here, which makes sense anyway because she is my own personal dentist. So how I got interested in dentistry, actually, it's kind of a funny story. I was a little bit of the weird kid in middle school, and for our science fair project, we all had to do this big science fair project in 7th grade. So I decided to do the effect of different liquids on baby teeth because my mom was like, guess what I still have? Your baby teeth. So I thought this would be a great opportunity to do a little science experiment. And so I put them in mouthwash and soda and milk and orange juice. The Coca-Cola broke them in half. That was pretty crazy. So in doing the research, I got really interested, and I actually started shadowing dentists at 13 years old and shadowed my local dentist. And then through a program I did in high school when I was interested in all different medical professions, I actually met my current boss, Dr. James McDonald, who runs the Smile Lodge in Clifton Park. And it was just a great pleasure to meet him, and seeing how passionate he was about pediatric dentistry, not just dentistry in general, really inspired me. I think most importantly, it was just these kids are so much fun to work with, and seeing how resilient they are. So they can be upset with you for 1 second for doing something, and then literally 5 seconds later, they're up, they're happy, and they forgive you, which is not the experience that I've had in adult dentistry at all. So then I went on to Syracuse University for my undergrad, and I then went to Maryland and met you, where I decided to pursue dentistry. And kept a very open mind, but unfortunately, pediatrics, it was what I was pigeonholed for. It's exactly what I'm made to do. And I tried to keep that open mind, but it didn't work. I love pediatrics, and that's where I ended up. And I'm so happy and grateful that my boss from when I was a dental assistant accepted me as a pediatric dentist, and I couldn't be happier with where I am now.
Wow, that is amazing. And Dr. Molly, I think you might have been a weirder kid than I was. And that's saying a lot because I was an obsessive tooth freak as well when I was growing up. But yeah, I think you might take the cake on that one.
It freaks my friends out a little bit that the actual teeth were like glued to my poster board a little bit. I think I could have like just had pictures as a substitute because that really did freak them out a little. But we got
No, I think I would have thought you were rude too. No, just kidding. That's physically
That's
impossible.
what dental school's for. You meet your people, you meet your weird teeth people, and you become a tribe.
Yup, a whole bunch of weirdos flock together. I absolutely love it. So tell me about the Smile Lodge. I mean, as a general dentist, I feel like so I practice with my dad, and it's just the two of us dentists, two hygiene, two assistant, two front desk, versus your practice seems like this massive enterprise. So what is it like? What is a day like at the Smile Lodge? I want to hear all about it.
So it's full of energy. We are a large group practice. So we actually have about 10 pediatric dentists or so on board, and then a couple general dentists who we do not do general dentistry, but they actually provide us the benefit of doing a lot of our procedures on teenagers and things who have much more permanent teeth. We're the experts on baby teeth. So we usually split the day. At this point, ever since coronavirus, we actually have two buildings, one where we're doing aerosol procedures, one where we're just doing exams and cleanings and things like that. And so you'll do hygiene for half a day, and I will see lots of different patients and families and get to meet everybody and do different treatment planning. And then the second half of the day, we're over doing our operative side, and we kind of switch back and forth with what we're doing. And it's just amazing. A lot of what we do at the Smile Lodge is full mouth treatment. A lot of the time, if the kids are able to tolerate it, which I really like, because in pediatric dentistry, you often see something called the sequential visit effect, where kids often don't handle treatment as well as they did the first time as they do the second and third time. So a lot of times we just work with them, and if they're able to get through it, if that's something that they're able to do, we go ahead and we're able to treat them fully in one day, which is really nice. So
wow, amazing. Now, so right now, so you and I, we're young dentists, we're associate dentists. What are your future plans? So are you planning on staying an associate? Are you planning on becoming a partner? Are you unsure? What do you think the future holds for you?
I think what I love about dentistry is you can keep your options open. Especially that was one reason I went into dentistry as a woman. I want to have a family, and it's really nice to have the flexibility. My grandfather actually was not a pediatric dentist. He was a general dentist, and he owned his own practice in Carlisle, Pennsylvania. And he was a very, very busy man. He ran this whole business, and I think my grandmother was one of his business managers and ran the business. So they were really busy. And the one thing I love about being an associate is I go to work and then I go home and I get to spend time with my family. So it's definitely practice ownership is something that I look forward to, and I think could be an option for me, or partnership. But at the end of the day, I'm currently really loving being an associate, and kind of want to get my family started. So that's currently what I love about it. Is it's a really great job and very flexible for those types of opportunities.
Amazing. So you keep mentioning family, you're a pediatric dentist, you love kids. So are you planning on raising a family? And if so, a little backstory, just for all of you watching, I am partially the reason why Dr. Kovalesky met her husband. But
probably 100% of the reason, actually. If it was
actually the full reason why they met. If I wasn't born, they might not be together. But anyway, so he works. He's amazing. Hi, Steve. I miss you. So Steve works. You, Dr. Molly, you work. So are you planning on raising a family? And if so, what would be your plan in terms of, balancing work and life? Because you and your husband, you guys are both working parents. And so what would it be like?
So actually, it's something we've been talking about recently is we actually are trying to start a family pretty soon, we're thinking. And I think I love the practice that I'm at, because we have a lot of women there, and even the men at the practice, most of them have children, and it's a very understanding and supportive environment where if I do choose to have a family someday, I work 4 days a week and I have a day off, but we've also mentioned that there's a possibility that I could go down to 3 days a week temporarily while my children are home. And then once they go to school, I could go back to 4 days. So just another amazing thing about dentistry is you have those flexible schedules, and especially working as an associate, I find there's lots of opportunities to work part-time and things like that.
Amazing. Okay, now my next question for you. So you and I, we're both young dentists, we're both women working in dentistry. What do you find are some challenges that you face on a day-to-day basis?
So a lot of the challenges I faced come to the fact that I look young. So there's always the fact that a lot of times when you're young and fresh faced, you get a few more questions and things like that. But when it comes to any challenges I've had as a woman, I actually did encounter one pretty recently that was interesting. I was recently extracting an adult tooth on a little boy, and unfortunately his permanent molar number 30 had to come out, and he was great. He was able to tolerate the procedure with nitrous, but it is a tough procedure where you feel a lot of pressure. And I was explaining, you can't take that away, and this is something that's going to take us a little bit of time to get the tooth out. Well, in the middle of the procedure, because our parents are always in the room so that they can see what's happening and be comfortable with the treatment, the mother said to me, is there any way this would go any faster if we got a man in here? Because it was quite a difficult tooth. But I was a little shocked in the moment. But luckily, this was not the first time that as a woman in dentistry, I have faced this question. I actually have some male friends who I love, but at the same time have asked me some silly questions like, aren't men better at taking out teeth because they're just stronger? And it's something that I took the time to just stop and say, I totally understand what you're thinking about strength, but this is actually much more about technique and finesse. And he's going to thank me for that tomorrow rather than just using brute force to get this out of there. So I said, unfortunately, it's going to take us a little time. I explained that teeth are attached to your bone with a ligament and things like that. And we were able to handle the situation and not have any further comments like that. But that was a challenge that I was surprised by being a woman in dentistry.
Oh my gosh. So how do you overcome things like this? And I do have to say, so I'm also a woman in dentistry. I'm also doing extractions and things like that. And I also, I get these kinds of questions and I'm like, but have you seen these muscles? I mean, come on. Like, they don't call me spaghetti arms for nothing.
She gets out the wisdom teeth. She gets out all the good stuff.
No, I'm serious. Some big man walks in. He's like 6'4" and 240 pounds. I'm like, I could take out that tooth if I want to.
Do you get the question? Are you going to be the one
have to question this? So how do you overcome that? What do you say? What do you do to instill confidence in the patient and their parents? What is your...
So like I said, in that situation, I just handled it by explaining what we're doing and why it takes time. But one thing I've noticed just to gain more confidence in myself and have the parent and the patient feel more relaxed are, as you can see, I am somebody who I talk very, very fast. It's the New Yorker in me. Even upstaters, we talk really fast. I have a lot of natural energy. So one thing I've learned is, especially when talking about treatment and post-op, all of those things, slow down. Remember that you need to kind of have calm. A lot of people see fast talking as nerves. So that was actually something that my boss taught me, and I really appreciate. Another thing is the art of the pregame. I have found in dentistry, it helps you so much if you really thoroughly explain to your patients and parents, in my situation, these are the most common things that you could see happening after today. I actually like to text a lot of my patients after I do operative procedures just to make sure that their kids are doing okay. So I will usually text their parents that night. And through doing that, I've actually found that a lot of solutions, like a lot of parents were telling me, oh, they're sore afterwards. So I just tell them now, go home. When you go home, give them ibuprofen. That way, when the numbing wears off, they're not too sore. I warn them that it's normal to have some soreness the first couple days. Adjusting to a crown, a stainless steel crown, they may not feel like their bite is right the first day or two. That will adjust in pediatric dentistry. And in addition, one of the biggest things that we see and one of the biggest problems in pediatric dentistry is lip bites. And that is the biggest thing I have learned to prep people for, is that kids, especially with masks nowadays and coronavirus, we're not seeing what our kids are doing, and they're sucking and biting on their lip, and it can cause a really nasty injury that to physicians and ED docs and dermatologists they will swear they had an allergic reaction and it is infected and all of these things. It is a lip bite. And so, but just by showing some pictures ahead of time, that's a challenge I've been able to overcome.
Okay, so what is the phrase? It's like if you say it before it happens, then it's a reason. And if you say it after it happens, then it's an excuse. And so you need to just prep them and maybe even over deliver to make sure that everyone is fully prepared, because maybe you and I, as young dentists, as female dentists, we just really need to overcompensate. Oh my goodness, absolutely correct. Now, how does it make you feel that maybe people don't have the same amount of confidence in you, you know, maybe as a young dentist or as a woman?
It hurts your feelings. Like when you first get that, oh, would this go faster if a man did it? There's definitely like that, oh, that makes me a little upset, that kind of hurt. I wish you had that confidence and faith in me. One thing I do remind myself is a lot of my male colleagues, they're going to go into the room, and for them, their concern is, are they going to think that I was gentle enough, or did they think I would be more gentle if I was a woman? So I do appreciate that and remember that there's certain advantages I have as a woman that I'm being perceived a little differently as well. So I do think that even though there can be downsides, like, you know, some people aren't as used to having female providers because it's a newer thing, or they think that men are stronger or maybe better at different things. There's also things that sometimes I feel like a lot of times there's requests for female providers because we have that mothering touch and things like that. So there's advantages and disadvantages to both for sure.
Dr. Molly, I am loving your message of just over preparing, being nurturing. I mean, that is just, it's so amazing. And they're really, so it's, you know, there's definitely disadvantages to walking in as a woman. Maybe we're perceived a little bit different, but there's also advantages where we are perceived as the nurturing ones. And I love that message. Now, if you had to summarize everything we're talking about today into one message for the other young dentists out there, what would it be?
For me, it would be dentistry is a really wonderful field for a young woman. If you like to work with your hands, if you like to feel like you're really being productive and doing something, if you like caring for people, I just think this is such a good job for a woman. It's a wonderful career path. There's so many options. I can't wait to see the future of people you have coming on here to hear about the different specialties and things like that. There's just so many different paths you can take. And I just think it's been such an amazing opportunity. And I'm only in the beginning, so I can't wait to see what's to come.
Dr. Molly, thank you so much for taking the time to be here. Thank you for being my best friend. You're an absolute inspiration and you're the absolute best.
As are you.
Thank you. I can't wait to have a bunch of little babies and bring them to see Dr. Molly. I will drive. I live in Maryland. I will be driving myself and all my little kiddos up to Saratoga, New York. It's a 6-hour drive just so we can see Dr. Molly. She is that amazing. Oh my goodness.
It's only fair if I do it twice a year to come see you. And get my teeth cleaned.
Oh my God. You are so amazing. Thank you so much for being here. For everyone watching, if you enjoyed this, please like it, please share it. If you have any questions for Dr. Molly or for myself, or if you want to just tell Dr. Molly how amazing she is, please, please, please leave it in the comments. We'd be so happy to get back to you. Thank you everyone so much for watching. I hope you have an amazing week. Take care, you guys.
Thank you.